Why did this not happen?
Let's ask that question to His Excellency James Ongwae, the Governor of Kisii County, who is the chairman of the Labour Committee in the Council of Governors. Good morning, sir.
Morning to you. Am I talking to Latif?
Yes, you are. In the room also we have C.T. Muga and Nduoko.
Thank you very much, and morning to you.
Good
morning, sir.
To this good radio station.
Asante sana for joining us. Welcome to the Situation Room.
Because you spice us quite a lot in the morning.
Well, so the first question is, we have seen copies, we have access to the copy of the return to work formula that was signed by the union and the national government represented by Health CS Mutahi Kagwe. And we see the part that you were supposed to have signed, you and your chairman, Wycliffe Oparanya, is not signed. What does this mean? Were you not in this meeting?
We were not in that meeting. But I don't think that is the broader issue. The broader issue is that for us to sign any document, because we represent, I am a chair for Labour, I represent the other governors, the 47 governors. And the chair for the Council of Governors, Wycliffe Oparanya, also represents the other 47 governors. So we had to call for a meeting of all the governors so that they can be taken through whatever return to work formula that was signed, which we ourselves had not signed. In any case, we would not have signed it without going through with them, and that's exactly what we were doing. We were going through with them the essence of that return to work formula, so that they can all agree, because they are employers, like our good lady there has just said. They are employers as of right.
But Governor, I'm a bit confused. I'm trying to understand. So are we saying that the two parties that had signed, the process was not complete? We're waiting for now the Council of Governors to come in and sign? Or are we saying that the process was completed and we're taking a back step and saying, hold on a minute, governors were not present here, so we need to go through this again and see, we're not going to sign it without having gone through it properly? Which one are we saying? It was completed, we're not consulted, or it has not been completed? The last part is where governors need to come in and complete.
That's a difficult one, again, to tell you, because frankly, the process, the conciliation process was still going on in the Ministry of Labour. So if the clinical officers, probably, because we are talking about the clinical officers, we probably don't have a lot of problems with the issue of doctors, because the issue of doctors did not have any serious financial implications. The issue of doctors was about working conditions and so on. It didn't have any serious financial implications. We are talking about the deal that was signed with the clinical officers. So what we are actually saying, Latif, is that in any event, even if there were discussions with these parties, those discussions would have to go back to the governors, so that, and that is what we've done before.
Okay.
We've signed the recognition agreement with with the nursing union. We signed recognition agreement with the clinical officers, but all the governors signed, and you people from the media were there in Delta House. We all came there as governors and we all signed.
So basically, just to go through the process here is that when such a meeting takes place, you are required as chair of the Labour Committee, as chair of a Council of Governors, to call the full council meeting and take them through what has been discussed. And then each of them then gives their consent.
Once they give their consent, then I put my good signature on that document.
All right. But in this particular case, the meeting that was taking place, first of all, were you aware that the meeting was taking place? Number two, were you party to the discussions and the 20-point agreement, the 18-point agreement that the union and the health ministry signed?
What I was aware of, and what everybody was aware of, was that there were conciliation meetings that were going on between the county government, the national government, Ministry of Health, and the Ministry of Labour. And they were being chaired by the Ministry of Labour, where we had our own technical officers, and those meetings had not been finalized.
Okay. One of the issues that has come out, Governor, is that this return to work formula and some of the tenets therein are unaffordable by county. That really there is no money at this time to make those payments. Is that the case? Or are we still looking at the vagaries of this formula? Which one is it? There's no money, or we're still trying to go through the details?
Actually, about 70%, between 60 to 70% of the issues that have been signed on, these are operational and administrative issues, and we do not have a problem with them.
Okay.
There is between 30 to 45% of the issues, and I could go through them with you.
Yes.
That have very, very serious financial implications. It's quite easy to tell somebody that okay, in the next, for instance, let's take the one of where we are saying that we will increase the risk allowance from about 3,000 to 15,000 shillings. And we are saying, even if you actually did say that you will do it when you get the resources, I don't think it is fair. It's not fair to even tell your kids that I'm going to buy you something I can't buy you.
So you're saying that this is too high?
If I take you through the raft of their salary and allowances,
Yes.
and I even relate it to you with the other cadres in the civil service, you will understand what I mean.
Okay.
If I probably take you for the doctors, you seeing the highest at job group, what we call a job group S in the civil service. The highest the doctor gets is about 197,000. That is the salary. The house allowance is 60,000. Then they also get a commuter allowance of 20,000. They get an emergency call allowance of 30,000. They get an extraneous allowance of 40,000. They get an unpracticing allowance of 60,000. They get a health service allowance of 20,000. The entire amount comes to about 363,000.
So this is the highest paid doctor in the county.
That's for the doctors.
Okay.
That's for the doctors for the highest, yeah.
Okay.
If you come to the nurses, and I will just give you a simple idea for the nurses at a simple job group K. I have not gone to a higher level. At job group K, which is the entry level for engineers, for architects, for economists, and for the others, I'll just give you. The highest the nurse gets there is about 51,000. That's the salary. Then they get a house allowance of about 21,000. They get a commuter allowance of 5,000. They get an extraneous allowance of 20,000. They get a health risk allowance of 3,850. And then they get a health service allowance of 20,000. They get a uniform allowance of about 10,000. The whole salary comes to about 118. If you go, because we don't only employ health personnel in the counties, if you deal with an architect who has left the university or an engineer at that level, an electrical engineer or a civil engineer or a mechanical engineer or an agricultural officer who has done agricultural economics, or even actually a doctor, the veterinary doctor, you are dealing here with an higher salary of about, at that level, of about 51,000. Then they get a house allowance of 21,000 and a commuter allowance of 5,000, and that's all they get, which takes their salary to about 64,000. When the others at that level, the nurse is getting 118,000. So these are issues that sometimes, and this is why I want to talk to you, media, because I think that you have been extremely unfair. If I was working in the media where you're working Latin, I would do those comparisons so that it doesn't become just easy to say, listen to them, give them what they want, and so on. If that doesn't happen, then there is a stigmatization of the governors, that they are not giving them what they want and so on. It's a broader issue than that. Governors have got in the county government, just like in the national government, we have almost about 30 or 40 other cadres that we are also dealing with. We also have salary structures that are completely inflexible because the salary is actually approved by the SRC. And one of the things that we were also saying, even when we were discussing as governors, is that some of these issues we probably needed SRC approval.
So as I understand you, and just using the examples that you've just very clearly given us here, a nurse at Job Group K is earning 118,000 shillings total.
At the maximum.
Maximum 118,000 shillings, while an engineer or an architect or a veterinary doctor at that same job group will go home with thereabout of 64,000 shillings, or maybe even up to 70,000 shillings. So there's a difference there.
Yes.
Now, if we say that also a clinical officer maybe in the same job group will of course be earning about a bit higher, the point that the council is then raising is if we increase the allowance by a further 500 to 650%, you're taking that payment much higher than now, even what you currently already have.
You see what we are saying, and people can make noise wherever they are listening to the radio, but we are here dealing, I do believe that we are dealing with facts.
Yeah.
And facts don't lie. So if we are dealing with facts, we must also accept the realities. For instance, at the moment, we must accept the reality that we have a pandemic. Mm-hmm. We must also accept the reality that our economy has shrunk. That's a reality. And it's not only in Kenya that the economy has shrunk, so that we start stigmatizing even national government. This has happened in this world that we are living in.
So do I hear you say? Do I hear you say, Governor, if I may interject there, that if we're doing this comparative analysis between health workers, nurses, for example, and other cadres of careers in the country and what they're earning, that is there a plea then from your side to say, accept this because as it is, you're earning more? So just hold on until we get things better?
The plea that I'm making is that it can't be about salaries all the time, because I have been the chairman for Labour since we started the Council of Governors. That's for the last 8 years. And if you recall, in 2017, just before the last general elections, we were on we had a big problem with the nurses and with the clinic officers. In fact, for the doctors in 2017, for 100 days, they were on strike. For the nurses, it was 153 days.
Yep.
153 days, that's about 5 months that they were on strike. Mm-hmm. And when the strike ended, of course, again, listening to the Kenyans and everybody, they came back to work, and we also paid them even for those 5 months that they didn't work. Mm.
So why would the grievance be so strong at this point? And I know one of the things that has come out come out with this grievance is COVID-19. They've talked about the PPEs and they've talked about all of these things coming into, which have all come into this return to work formula. They've all been represented there. With what you're saying, why would there be such vehemence from them saying that something needs to be done?
You see, if it was the issues that related to their working conditions, like for instance, we had been requested as a council that we put aside utilities, or we put aside specific special wards for the health personnel, which we have all done. Mm. If it was also about PPEs, that please give us PPEs, but also ensure that the PPEs are up to standard. That any county government that doesn't do that I would not understand. Because each county government should be able to give the workers the PPEs, and the PPEs must be up to standard so that they don't become sick. But when you mix that also with additional, an increase in salary, an increase in basically your personnel emoluments, then you are getting into trouble. And also when you do it in a time of a pandemic, when we do not know of any country in this world where health workers have done so. And incidentally, if I have to say, and again here we are dealing with facts, if I was working in a radio station, a good radio, one of in fact right now the best radio station in this country, if I was working with you, I would do a comparative analysis of their salary with the other salaries of health workers in the sub-Saharan Africa.
Mm-hmm.
And you can take this to the bank, that we probably are paying the best salary in sub-Saharan Africa for health workers apart from probably South Africa. So it can't be about salaries. There is also the broader context of even the Florence Nightingale concept, which should apply to the health personnel.
Are you talking about sacrifice?
It's not sacrifice. It is the call. Like now, you have your own call as a professional in the area of communication. What's your calling? You have a calling, isn't it? So there is a calling for every cadre. There is a calling for every specialization. And that is all we are saying. The simple calling is, for instance, Florence Nightingale relates to humility, relates to sympathy, relates to loyalty, relates to devotion, relates to obedience to the calling of your profession. So we are saying that there are times and times for strikes, and there are times when they shouldn't be. Like the time during the pandemic, when everybody is suffering, that's not the time to go this route, because this route smacks of some form of blackmail.
One of the things that you could say that had led to the clinical officers, the doctors and the nurses going on strike, Governor, even with addition now to the issue of personal emoluments, is the issue of their own well-being in their workplaces. If that had been addressed from the very beginning, if, for example,
and that's why I've told you, Latif, I've told you, if it was working conditions, that you can beat me.
Let me ask this question, Governor.
We should actually be dealing with working conditions. Strictly working conditions, working conditions, working conditions.
Governor, you know, we actually hear you, and you have a point, and there is a gap. There is something that we in the media have actually not done well, and we thank you for pointing some of these things out. However, let me ask of you this. Are you saying that every governor in the country has been able to do the very things that you're saying?
I am saying that, and again, you can take this to the bank. If you go around, if you are looking, you will probably find almost close to 90%. Even in your own house, there are certain things that you don't do. If there are a few counties that have got specific problems, let them be mentioned. And we as governors, even when we are together, when we are in the room, we can then tell each other that, hey, you have not done this and this. But this generalization, I do not accept. And this generalization makes some people get away with murder.
Let me ask then
because
a different question.
Then it becomes easy to generalize and actually say that these governors can't do anything else. These governors probably are only used to doing these other bad things and so on. That sells. That sounds very good to the common man. That is easier. Stigmatizing a certain profession becomes very easy, and those others who are doing wrong things get away with murder. And that's what's happening at the moment.
But let me ask this question. One of the things that has been a sticking point every time health workers go on strike is not necessarily what we hear now about the increase in salary, but the actual payment of what it is that is due to them. Let me ask the question I want to ask with reference to this. Do the governors get the support that is required from the national government to be able to meet these demands? Just paying salaries normally, because many strikes we've come across have had to do with salaries delaying, not for a month, not for two, but for even longer than that.
Now let me tell you.
Please go ahead,
Let
sir.
me tell you that.
No, this is not Latif. This is CT Muga.
Muga.
Yes, sir.
Thank you, CT. Now, CT, before the pandemic,
Yes.
if there was any county that was delaying in paying salaries, it was an administrative issue that was county specific. I'll give you the example of my own county where I come from, Kisii County. We do not as a matter of principle, delay paying salaries. We have never delayed, and my workers, wherever they are, they know that. Now, I'll give you the example for COVID. When COVID came in, we all as county governments understood that government doesn't, national government or the treasury doesn't have enough resources. We have not received the resources for 3 months, all the county governments. But that has not stopped us from paying. We have used methods. We have looked for resources. Some of us have gone to the banks to actually get overdraft so that we can pay. So, like in my own case, I'm up to date in payments. Of course, I don't tell the workers that I've not got money from the treasury. I pay their salaries. Their salaries have been paid, even though I've not received money for 3 months. Now, tell me this. Do you actually go and in such a situation, in a situation of a pandemic, in a situation where you empathize with national government because of the shrinking of the resourcing base, is that a time that you can also actually agree that you are increasing allowances?
When would be a good time? What would you prefer in terms of when should these grievances come out? Because it would seem as if that these grievances exist. COVID has exacerbated these grievances. What would you prefer in time, in terms of time that they can bring these out to the fore?
I would not prefer, ma'am, that there should be any grievances. And the grievances, if they relate to their working conditions, what they need in order to actualize their professional work, those grievances can come in any time. If we are dealing with lack of PPEs and so on, for God's sake, those grievances can be any day, any time. If they are dealing with their own welfare in terms of, because they are much more exposed and they need to be taken care of much more than anybody else, that is understandable. That can come in any time.
It seems that's one of the things that has come out.
If you bring that out, you also add the whole issue of additional salary, then you really would be, I think you would be slightly unfair. So in a time like this, what I would expect, which I expect even if you are the one who was working in the health service, you need to complain about your working conditions.
Yeah.
Because you are a human being and you are bound to actually become sick.
Fair enough.
So it's logical.
Fair enough, Governor. One of the things that came up during this whole talk and the negotiations and even the strike notice was welfare, some of which had actually been discussed, and even the president himself pronouncing himself to this and saying, yes, during this pandemic, because our healthcare workers, our frontline workers, they're the ones exposing themselves to this fight against COVID, let's increase their allowances. So the issue of allowances during the COVID is one of them. The issue of them getting access to health insurance or enhanced health insurance is a second one. The issue of them getting that group life cover is a third one. And we've seen these stories coming out. A doctor dies and they're left destitute. Their siblings or their families are basically left destitute. That's what they were bringing out. We have seen it happen. A doctor has died. They do not have medical cover. Their colleagues and friends and family are the ones who are contributing for them. And after they've died, their families are left without anything. So when you talk about now the group life cover and the enhanced allowances, those are about their welfare at this time, are they not?
Absolutely, and that's what I said, if it's about their welfare. But welfare, don't mix welfare with increase of salaries and other allowances. For instance, the allowance that you are talking about was a specific allowance that was given by the president. It was called COVID allowance. And it was a specified allowance with a time frame.
Yeah.
So it was not something that after the time frame, you then formalize. Because that is the route that has been taken.
Yeah. You
don't formalize a specific allowance that has been given for a specific period. Now, on the issue of medical cover, that is a logical and important issue. But I will tell you that the issue of medical cover, and let's be fair also to the other workers that are in the counties. For instance, in my own county, I went further all the workers in the county have got the medical cover, which is also enhanced. So you also, if you are doing some of these things, for God's sake, if you have workers, just ensure that just like in your own house, you can't have special ones that you are giving special food and the others you are giving them different food. It doesn't work like that. And the lady who is in the room that you are sitting will tell you that won't work.
It won't work?
Yeah.
So the three issues that you've raised here with the health
lady
CS.
doesn't want to take care of the kids for us. She will tell you that, please, all these are my kids. I have to take care of them well. But this other one, for instance, if he's doing some of these other things, he probably is working overtime. I
Give
will
him
have
a
to
little
wake
extra.
up at night. I'll have to wake up at night, make him some tea, and so on. And that's what we've done for the medical personnel. We have said that they are working beyond the call of duty.
So the three
And
issues.
the other things that they are doing that are supporting other human beings, that we have taken care of.
I want to come to the three issues that you raised in your letter to the health CS. I mean, the letter written by the chairman of the Council of Governors to the health CS. One is raising the issue of risk allowances and saying that's too high. I think we've already discussed that. The second one is the conversion of contracts to permanent and pensionable. One of the things that, and this has come up in our conversations with doctors, nurses, clinical officers, and other cadres of healthcare workers, is that issue of being employed on contracts that are even less than a year, and you're not even sure how long you're going to be in employment. Don't you think it would be fair that every employee then gets some sort of permanence in their sort of contract?
Latif, when I came into the county, when I came to Kisii County, there were only 17 doctors. I have now employed 176 doctors, and I want to employ more if I have resources. In fact, out of those 176 doctors, I have released 67 of them to go for master's training, to go for specialist training, because I want, whether it is in oncology, whether it is in pediatrics, whether it's in general surgery, whether it is in whatever it is, whether it's in as a general physician, I have released 67 of them, and I pay their salaries. They are doing their masters, and I want to employ more. So if I got only 17, I have employed over 170. It's not an issue of somebody of counties not wanting to employ. Now, in this particular instance, the government decided that probably because of the financials and these other things, let's have a stopgap measure. So the stopgap measure was put in place, where the contractual issue came up.
Yeah.
And I've even had this contractual issue actually being talked about all over, that we probably need to put people on even employment needs to be on contract. I suspect that in your workplaces, some of you are on contract.
Yeah.
But that's not the issue right now, because you're on contract and you sound like you people are fairly happy people. Now,
Not everybody who loves you, Governor. Not everybody who says they love you loves you.
Governor, you have a wonderful sense of humor.
but anyway, coming down to this, it was a stopgap measure. And the government decided that let's take in, even if it's for a short term, let's take in these people for this and this period. In my own county, I found in nurses that were on contract, that had been brought on contract, some under Care Kenya, some under whatever. When their contracts ended, when I looked at my financials, I took them over. So this is a matter that is negotiable, but it's not a matter that you then have to direct, because what you are doing then to government is that next time you are telling them that even if there is a crisis, even if you do not have resources, do not then do any stopgap measures. That's basically what you are telling government. That's what you are telling national government, and that's what you are telling the county government, that if you have any particular, if you have a problem, And you can take this to the bank even where you are working, you people are working right now. There are certain instances that you bring people on contract, and when they finish what they are doing, they go away.
Yeah.
But we were not saying that these workers go away. This was an issue that can be negotiated. Probably you can negotiate that, okay, extend the contract. Some you can extend the contract, after some time you find that you actually need them. That's the nature of work in the entire world. In the developed world, all the workers are on contract.
Governor,
We have not reached there.
Governor, in your county, the county of Kisii, have your health workers ever threatened to go on strike for whatever reason?
They have never threatened to go on strike unless they are supporting other workers, which they are doing right now. Because I do everything. I have meetings with them. I do everything they want.
Then would you say
Without
that,
taking
would you say
money.
the same is true of your brother and sister governors across the country? Because for there to be a complaint, unless we're saying that these health workers are lying to us and that the problems that they have are not really what they are saying they are, then it means that there are counties, now this is not a blame game, I'm merely stating the facts, that there are counties who probably don't meet these basic obligations that the health workers expect them to meet.
That may well be. It is the same analogy that you can have for every house. There could be houses where people eat meat and ugali every day. There could be houses where people are eating ugali and sukuma wiki every day. I mean, that could well be. But the ideal situation is where you are ensuring that the workers, if it's health workers, if it's working conditions, if they are going for surgery, they have the right PPEs. That is the ideal condition. If they are nurses or wherever, that in whatever, like during the pandemic, that whatever basic minimum that has been set by the Ministry of Health occurs in all the counties. And that's what I would want to see from every governor, including myself. And that's what I think I would vote for the governors. And that's why I said when we started, please tell me which county. Don't generalize.
So
Because
are you saying, Governor, that
generalization is very easy to advance an argument.
Yeah.
okay?
It's very easy to say these governors are thieves. That sounds beautiful, sounds perfect.
Sounds scandalous. The things that people would like to hear.
And sells. You put it in the headlines of your newspaper, it sells. It sounds real nice.
Sure, but I'm
And
still...
the people understand that. They want to understand that.
Governor, do you think that there are clinical... Let's just take clinical officers, for example, because this is the bone of contention right now. And even with lab technicians as well, who also have not heard their pleas. But do you really believe that there would be those who go onto the streets, like their chairman has said, go back into the streets in 48 hours? Are you saying that they would get onto the streets knowing full well that the benefits and allowances that they're looking for have been catered for, their salary is being paid without any problems, but they're on the streets protesting? Do you think that there are individuals who would do that? Based on what you're saying, that it's a generalization and that county to county people have been sorted out. Are there those who would go on the streets just to join the foray because they don't have anything else to do?
If they go on the street arguing that the basic necessities to do their work have not been met, I will understand them.
But these are some
if
of the
they
things that
go-
they're saying.
Just listen to me, please. And that's where you're going wrong. Because you are not demarcating issues. If they go to the streets, that their working conditions and others have not been met, I will understand them.
Okay.
But if they go to the streets at this time of the pandemic, that even through what I have taken you through, what they get, that they need some more money on their salary and allowances, then that I will not understand. And if you support them as members of the media, then you don't live in this country. And that's what is happening. You do your headlines, whether it's print or electronic media, you are doing your headlines there without doing your research and without understanding the conditions under which we are living in this country at the moment.
So it's about two issues then. So it's about welfare and the basics. Give us PPEs,
Yes.
give us an isolation ward, give us some just enhanced allowance during this period. help us to be able to meet our medical needs and our insurance cover. Those ones on one side. And then there's the other of put us on permanent and pensionable contract, give us an enhanced life cover. Those are different issues in as far as you look at them.
Enhanced cover may go into the first one because it's related, it's supporting their, because they work in very difficult conditions.
Right.
Enhanced cover, that goes to the first one. But the second one, where you are dealing with salary and emolument, you mix it with the first one because you want to get away with murder. That is completely and absolutely unacceptable. That's what I'm telling you.
Understood. Have you had these conversations with the unions and their leadership? For example, since this meeting took place and you did not attend it, have you reached out to the union leadership and told them, guys, come? So in as far as point number 1, 7, 16, 6 and 5 are concerned, these ones we are okay. These are the points that we have an issue with and we'd like further conversation on, so that you avoid them, getting agitated and calling for a fresh strike.
For instance, if even the allowance, the COVID allowance that you are talking about, if, for instance, they were even saying that, well, the first one lapsed, can we discuss about
extending it,
an extra COVID allowance?
Yes.
Specific, another 3 months. You can understand. But when you want to formalize that allowance into a permanent feature of your salary, then you are talking a different language.
Is there a way that they can understand this? Because as you've said it, like now, the way you've said it, Governor, is clear, right? If they say that this is an issue that they have, allowances because of COVID-19, it is clear. But has it been made clear to them?
If you have time, I have been chair of labor for the last 8 years.
Yep.
And I would tell you I've sometimes gone through well. So I will invite you one of these days and say you work in the Council of Governors and you just sit in and listen. And you will ask those questions so that you can then go to see what we go through. And when we get out of there, then you get a stigmatization that Council of Governors don't care, they don't do this. And because that medium that is actually saying that is the same medium that can get you out of hell. So you don't have where to go because that medium has already stigmatized you. So where do you go?
I can't imagine that it would be a walk in the park. But here you are at an impasse, right, Governor? You're at an impasse here between yourselves and clinical officers, for example, who are a much needed force in the health services of this country. What you've explained, like I've said, makes sense. But the people who would be in the position to take it from you clearly are not hearing this message. How will they hear it?
You want to hear yourself. You are not, even you yourselves, I'm trying to talk to you people. You are not listening. I want you to listen this. That make a demarcation between those allowances, between working conditions that ensure that our health workers do not become sick. That they don't take this sickness back to their own houses. That they remain healthy. And we all survive this pandemic. Make a distinction between that and anything that is addition that increases your salary, so that then this conversation can make sense. But if you mix the two of them, then the other one, you are hiding another issue in order to support. And then I want you also to go back to basic. Go, because you people are completely ICT compliant. Tell me which country in Africa where you have workers who have gone on strike during the pandemic. And then look at the salary structure of all the countries in Africa and then look at our salary structures and our allowances and tell us how we compare with those other countries where workers have not gone on strike. Then I will know that you are doing your work.
You've articulated yourself very well, Governor, this morning in terms of this is where you stand, this is how you see the issues, this is how you demarcate the issues, and this is what you'd like the workers to also understand. We have seen the issue of health workers over the last 8 years coming up many times. Like you've said, in 2017, they went on strike for more than 100 days, doctors, more than 150 days, nurses. and they keep cropping up. In fact, even featuring in some cases, in some instances, in issue of the impeachment, for example, it forms part of the grounds for impeachment of a governor. Why do you think the issue of health workers, just the one cadre health workers, keeps cropping up in the counties and not the others, not the engineers, not the veterinary doctors, not the other workers in the counties? Why is it that this one group of professionals keeps raising their issues over and over and over again?
Sometimes, if you are a cadre and there is a certain level of indispensability in your work, then you probably feel that the hostage idea then comes in. I'll give you an example right now, and it's going to happen. I'll tell you that where we have reached right now, I advertised for positions for clinical officers and for nurses in Kisii County. I have 3,000 applications for clinical officers, people who do not have work.
Yep.
I have about 4,000 applications for nurses, people who have finished training who don't have work. And then you get a cadre where people go on strike for 5 months. When they finish, they then work out a return to work formula where they say you must pay us for those 5 months. This must stop. And as Kenyans, you must understand where we're coming from. This must completely stop. If they are coming back, let them come back, but those 5 months they were out, they don't get paid. And we want you people in the media to support us.
How would you like us to support you, Your Excellency?
Support us, because if you, for instance, went on strike in Spruce FM, and you went on strike for 1 month, and then you came back and told the workers of Spruce FM, if this period I've been on strike, you must pay me when I was not working for 1 month. And you can take it to the bank. They will not pay you.
Okay. Governor, it's interesting that you had mentioned talking about, all right, let's look at other countries on the continent specifically where health workers would have gone on strike during this COVID-19 pandemic era. So in Nigeria, issues of concern that were raised by health workers, they did go on strike. Good pay and poor working conditions were taken into consideration. The government acted. They had spent 20 billion in terms of naira on hazard allowances for healthcare workers and increased that as of the 8th of September 2020. In South Africa, the lives of health workers were endangered due to COVID-19. They complained about inadequate supplies of personal protective equipment. They complained about the danger for workers who are on the front line in the battle against COVID-19. President Cyril Ramaphosa, spokesman, for example, stepped down after being linked to irregular purchases that would have helped these health workers. And the Gauteng provincial health minister was also forced to step down because of allegations linked to the irregular procurement of health supplies. And the allowances then of health workers then had been increased as of September 3rd, 2020. Those are two examples on the continent that you had asked about.
But also around the world, there were strikes.
Around the world, there were strikes in the United States, in Spain, in Greece, Switzerland, France, South Korea, in Sweden. And we're looking at several states around the federal system in the US.
I did not say they should not go on strike. I say they should go on strike for areas that relate to their work. I said they can complain. And you're the ones who asked me. I said they can complain even tomorrow.
We agree with you,
sure.
Your Excellency. And as my colleague Eric has put it, you have put forward a very compelling case. But you see, take a look at these issues from our perspective. We speak to people who head the unions of the nurses, clinical officers, and doctors, and they tell us about their plight. Now, it isn't county specific.
We do not have a problem with the doctors, by the way, so don't bring in the doctors.
Not anymore, but there was.
No, because the doctors, they didn't. There was nothing that was relating to additional. We were very the doctors. It was about their working conditions and so on, and we do not, and they which was logical.
Actually, Your Excellency, I'm not seeking to lay blame or direct blame. I am actually seeking to follow the trajectory of the argument as you have laid it out and just looking at the facts. You see, for people to take the steps that the health workers have taken, I am saying that they must have reasons. Now, it is true that you cannot, and it is wrong to lump everybody together in the same basket and say it is the governors who are doing this. However, these aren't mad people who simply decide because the moon has shone wrongly on their heads, and on that particular day they decide they're going to go on strike. They have reasons why they go on strike. And some of these strikes, the issues are cumulative. It didn't happen during COVID. Some of them started even long before COVID. Now, where am I going to? I'm going to this. The discussion that you've had, you said perhaps you'll invite us. I would urge you to invite us, because I am having difficulties understanding how the argument you've put across to us, which is very convincing, if put across to the leaders of these unions, why they would not understand it.
Okay, let me go back to base.
Right.
And please listen to me. I told you a nursing officer in Job K at the highest level gets a salary of 51,000, gets a house allowance of 21,000, gets a commuter allowance of 5,000, gets an extraneous allowance of 20,000, gets a health risk allowance of 3,850, gets a health service allowance of 20,000, gets a uniform allowance of 10,000, and it comes to about 118. Then I told you, an engineer who has come from the university, who gets into that, or an architect, would take home 51,000, which is and then gets a house allowance of 21 and a commuter allowance of 5,000, and that is all, which is a total of 67,000. When the other one is taking home 118,000. So I was not complaining. I was just giving you a comparative analysis.
Right.
I'm telling you that this government, both national and county government, we have tried at least as much as we can within the broader context of the affordability criteria, and within even the broader context of trying to ensure that we support them much more. So basically what we are doing is we are supporting the health workers much more than we are supporting the other workers, because we recognize the importance of the area of work, because like you can see here, the nurse is probably getting twice what the engineer is getting. But we are not complaining.
Okay.
And that's what I want you people to listen to.
That's
what I'm asking. That's what I'm asking, that please listen to us.
We get it.
Even those allowances that we are talking about, and I'm the one who's just said it, if we are dealing with an extra COVID allowance after these 3 months, another COVID allowance, again, so long as you do not institutionalize it, because these are the allowances, it is not even 2017, and now it's not 2018 when this was given. It's just about 3 or 4 years ago.
Okay.
Actually,
So
just 2 years.
What are we actually saying here? Are we saying that if we again improved now, in the next 2 or 3 years, again people will go on strike?
It's actually you put up a very, very strong case here, Governor, and we thank you very much for that and for articulating the issues very well. Would like, as we conclude this conversation with you this morning, for you to pass 2 messages. One message passed to the health workers, particularly the clinical officers who are listening to you. The second message passed to the citizens, who are the ones who consume the services of these clinical officers. What would you like to tell them? Start with the medical workers.
As for the medical workers, those who work in my own county, they know I meet them. They know I've met all their requirements. They know they work under conditions that have been recommended by the Ministry of Health. And I would urge that all the governors, whoever is listening to me, whichever governor that is listening, let's have the basic minimums. Let's support all our workers. Let's ensure that all the conditions are appropriate. I would kindly request all the workers, the clinical officers, don't take that route. The route of strike and so on, especially during a pandemic, it's not a right thing. Let's negotiate this and let's demarcate the issues. Between those issues that relate to strictly working conditions and the issues that are long-term. If we do that, then we will not go wrong. As for the Kenyans, whoever is listening to me, I would want to indicate that as governors, we have really tried our best. And I was giving you the example of Kisii County, where I had only about 17 medical officers, doctors, and I now have over 170, and I've taken for master's training over 67 of them, because I want to have specialisms in all these medical areas. And we are also trying to do the same even for the other paramedical cadres. If it's nurses, you want a nurse who has gone for further training in oncology, in dialysis, in all these particular areas. And we can say that in general, there has been a complete improvement of health service across the counties, because if you go to Northeastern, for instance, you now seeing things that were not there. You come to the counties, you are seeing additional beds. In nearly all the counties, in my own county, when I came in, there were only 450 beds. I now have 900 beds. So there have been improvements and increases and so on, but we also work within a very, very tight environment, which we must accept. So sometimes one may sound, or like I could have sounded like I'm being hard or something, but I'm trying to say that the conditions are very difficult, because if for the last 3 months we've not received any resources, and we understand, and we go to the banks to borrow in order to pay salaries, then you are at a situation which is actually, because if I do not again pay these salaries, I would be in trouble. So I am asking fellow Kenyans that please do understand where we are coming from, and talk, because the health workers do not exist in a vacuum. They come from our own houses.
Right.
Please, let's talk to them. I wouldn't be surprised for the three of you are there that you probably have brothers, sisters, or cousins who work in the health area.
Yes.
Please, let's talk to each other. Let's go through this pandemic. Let's then sit down and talk to each other as Kenyans. Otherwise, I wish everybody a happy New Year. I hope that we are going to manage this pandemic this year, so that we can go back to a normal life.
Asante sana. James Ongwae, Kisii County Governor and Chair of the Labour Committee in the Council of Governors. Thank you very much for joining us this morning and for sharing all those insights with us.
Thank you, my brother and sister.
Thank you very much.
Right.
And I wish your station the best. You've really tried. You've taken that space by storm.
Asante sana.
Thank you, sir.
Right. This is the Situation Room. It's Kenya's biggest conversation. It's now 2 minutes after 8. Good morning.